Hello, I am Sven Francque. I'm professor of hepatology at the University Hospital in Antwerp in Belgium, and I'm specialized in what we used to call non-alcoholic fatty liver disease, but now we call it metabolic dysfunction-associated steatotic liver disease. Well, I think there are several unmet needs. First of all, we know that there are many people living with this disease that are walking around without knowing it. So there's still a lot of unawareness about this disease. So that's the first thing that we absolutely need to tackle, because we know that there are many people that are at risk, people living with obesity, or overweight people living with diabetes are at risk, but many of them don't know that they have a liver disease, or it might have been mentioned somewhere, but without properly investigating it. So that's, to me, the first unmet need. That's the unawareness. Another unmet need is that we still need to better define the modalities to make an accurate diagnosis of the disease. We do have some tools that are rather easy to apply, but they are not available everywhere. Not everybody knows exactly how to use them. So there's a lot of work to do on how we can screen or case find or investigate people that are at risk. And then I think once the diagnosis is established, there's also a lot of work to do about how to inform people what this disease is about and what they can already do to or make the liver better, or to prevent more worse outcomes in the future. So one of the final unmet needs is obviously the treatment of this condition. We do have some tools to help patients and to try to treat this disease or halt progression of the disease, or make even the disease get better again, because the liver has a huge regenerative capacity, which is reassuring. But specifically for this disease, we only have one drug approved since a few months in the United States. It was a success, but it's still just one drug and it's not approved in Europe yet. So there's still a long way to go to further develop highly efficacious treatments for this disease. In the guidelines that we recently developed together with the scientific societies for liver disease, diabetes, and obesity in Europe, is that, first of all, we of course summarized the new knowledge from the last almost 10 years, because the previous guideline dates already from 2016. But I think it's very important that we emphasize that with the current knowledge, there are people in whom we should screen or case find for this disease. So it's really a clear guidance on in whom we should look for this disease, and also how we can do it. There's a tiered approach with non-invasive tests. We start with a simple score that you can calculate based on liver enzymes and age and platelets, which is called the FIB-4 test. And then there are indications as a clear algorithm on how to interpret the results of that test and what to do further when the test is in the gray zone, or when it's clearly positive. So really emphasizing that you should, in certain categories of people, specifically look for the disease, and how you should do it, I think is already a very important new element in this guideline. And it's important also to emphasize that this is a shared guideline, as I said, by societies specialized in diabetology, in obesity, and in liver disease. So it's really a joint effort, and 3 societies endorse these statements. So that gives clear guidance to specialists from different disciplines to tackle this problem. Another important aspect of the new CPG is, of course, the treatment. There is quite some evolution in our knowledge about treatment. There have been a lot of phase 2 trials with different categories of drugs, and all these results are now incorporated. So what you can do if you have a patient, what you can do with currently already available medication, which is not always licensed, of course, specifically for MAFLD, but which is licensed for the comorbidities in which metabolic dysfunction-associated steatotic liver disease develops. So we do have some treatments that also are beneficial for the liver, or for which at least we have phase 2 data or phase 4 data supporting some degree of efficacy for the liver. And so we give clear guidance on how to use these drugs and in which indications. And then, as I previously mentioned, we have now also a first drug approved specifically for this disease, not in patients with cirrhosis, but in patients with significant and advanced fibrosis. And the guideline will also give clear guidance on how this medication can be used in clinical practice. And one of the last points in the new CPG is that we clearly emphasize that this problem should be tackled in a multidisciplinary approach. This disease is part of a multisystem disorder. The liver is suffering, of course, from the cardiometabolic comorbidities, but is also contributing to the cardiovascular and other metabolic morbidities. So it's really important to emphasize that multidirectional relationship, and that is reflected in how we propose to manage this disease, multidisciplinary with the patient, with several disciplines involved. That's also why it's a joint guideline of 3 different societies, but that's also what we emphasize in the management recommendations, that it really should be tackled in a multidisciplinary way. An area that still needs a lot of attention is how we can not just diagnose, but also monitor the disease. Of course, this disease has been shaped, I would say, in its understanding by the liver biopsy. And the liver biopsy is still a very valuable and important tool in specialized hands, but it's obviously something that is not usable in routine clinical practice. We have now gone quite a way in working with alternatives to the liver biopsy to make a diagnosis of several important aspects of the disease, the severity of the steatosis, for example, the severity of the fibrosis. We're still not so good at assessing the severity of the damage and the inflammation. But as I said, in terms of fibrosis, steatosis, we're quite good. What is really something that we need to work on is how we can monitor the disease evolution, which is something different than just making the cross-sectional diagnosis. And there we start to have data also from the huge amount of work that is ongoing in trying to understand how we can work with these non-invasive tests, to understand how we can use it to monitor disease evolution or to assess the response to a treatment that is started. But there is still a long way to go. Yeah, that's one of the unresolved issues for the moment. We start to have clues, as I said, but there's still a lot of work to be done there. Well, I think a first opportunity, and I forgot to mention that previously, but what also is an important change in our field is the change of the nomenclature. And we changed from not only from non-alcoholic fatty liver disease to metabolic dysfunction-associated steatotic liver disease. We also introduced the umbrella term of steatotic liver disease, which is a broader focus than just what is related to metabolic dysfunction. So an important opportunity is that we really also emphasize in the guideline that we have to look at all factors that have an impact on liver health and especially liver steatosis, which means in clinical practice that, of course, we just also have to look at consumption of alcohol, for example. So it's a more holistic approach, not just, as I said previously, in terms of metabolic, cardiovascular, and liver, but also in terms of a more broader approach to liver health or health, cardiometabolic health in a more broad sense, not just focused on the liver, not just focused on metabolic dysfunction, but a broader, more global, more holistic approach to liver health or cardiometabolic health in general. So I think that's a very important opportunity of this guideline. Challenges, as I said, yeah, it's a continuously evolving field. I think the awareness and translating this into increased knowledge among people at risk, but also among all healthcare professionals, first line, second line, third line, in the different specialties, that is still an important challenge. We have the guideline. As I said, it's a joint guideline, so that gives a lot of opportunities to involve different specialties, but still, in terms of awareness, teaching, education, there's still a long way to go. But I think this guideline can be very helpful for that.